Aubrey is the developmental specialist at Kids on the Move. She has worked with kids in one way or another for most of her life. She started working with children with autism in college and has continued to work with children with developmental delays and disabilities ever since. She has nearly 20 years of experience in the field. She is certified in the DIR floor time method and uses that child-led approach in interacting with all children. Toilet training is always a hot topic in parenting, and she's excited to discuss it with us more. So without further ado, this is Aubrey.
Are you ready?
Good morning. I am, like most of you, coming to you from my house, and doing these virtual trainings I think provides us a really great opportunity to share information together when we can't be together in person. I will say I definitely do not prefer virtual. I wish that we could all be together so that I could see your faces and read your body language and see if you want to say something or things like that. But we don't have that luxury right now. So we're just gonna make do the best we can with things as they are. I can kind of see the chat window. I will let you all know I am connected to Zoom on my phone. And so I sometimes don't necessarily see everything. So like I said, we're just going to do the best we can with our technology here. If you do have questions, I'm more than happy to answer questions if you want to just put those in the chat, as like was mentioned previously. With the nature of the group, the size that we have, which I'm really excited about, I don't know that we'll be able to have people unmute themselves and ask questions. I'm not opposed to that. I just am not sure with our size of group if that will really work super well. If you type something and you're feeling like it's not being addressed, feel free to unmute and pipe in. But for the most part, I think we'll just kind of work with the chat window. We also may not have a lot of time to address individual questions about your child, but I'm happy to answer questions. If you even take a screenshot of this first slide, my email is there, and I'm happy to kind of brainstorm with you. I am by no means a potty training expert, but I would be happy to kind of troubleshoot a little bit with you if I can. So we will just get started. We are scheduled for an hour today. I will keep us to an hour, so that may not leave us as much time as we hope for certain topics, but we'll just kind of get through what we can. And like I said, feel free to reach out to me after this is done if you have, questions or anything like that. So Camille is going to be sharing the slides with you. So at some point I may not quite be right on the slide that we're talking about, but it will, again, we'll just do the best we can with technology. So this presentation is coming, I would say, I used the AHEAD curriculum, which isn't something that's available generally. It's a curriculum we have available at Kids on the Move, and I've used a lot of the handouts in the past, so I'm kind of gathering some information from there, a little bit from the Love and Logic curriculum, and honestly, a lot of this just comes from anecdotal experiences, things that I have observed over the past 20 years in working with children with disabilities and delays and typically developing children and all of the above. Potty training, like was mentioned in my introduction, is always a hot topic. People are always very interested in it, and there really is no magic bullet when it comes to potty training, unfortunately. I'm sure some of you are here today hoping I'm going to give you a magic wand to get your kids potty trained this summer, and I wish I was too. But we're going to get started just kind of talking about some of the preliminary things we need to pay attention to before we even start the process of toilet training. And that is the concept of readiness. And I work with kids from birth to 3 exclusively. Occasionally I see a kid over 3 privately, but in my day-to-day work, I work with kids under 3, and I will tell you almost none of them are ready for potty training. There are a few exceptions, but I want to go through these readiness things so that you can kind of evaluate as a parent and your child, are we ready to take this on, or is it time to hold off a little bit or work on some of these readiness principles? So I like to start off actually with addressing the readiness of the parent or the caregiver, or parent and caregivers. Do you have the time available for toilet training? No matter whether you have a child with a diagnosis or another special need or typically developing kids, it does take time, and secondly, patience. I don't think anybody really enjoys the process of potty training their kids, but I will say when everybody involved is ready, it can be a lot smoother. So I am going to spend a decent amount of time talking about these readiness factors. In terms of patience, how realistic are your expectations? Do you have the patience to deal with accidents? Do you have the patience to deal with cleanups? Do you have the patience to allow your child to sit on the toilet for a decent amount of time to hopefully have some success? All of those types of things. Are you prepared for your child to be independent? Sometimes we think we want our kids to be independent, and as they start doing things for themselves, we find ourselves not quite ready yet. We find maybe something like um, we don't have the patience or the preparation to allow kids to be splashing water all over the sink and all over the mirror. So these are things to take into consideration, definitely. And lastly, are you set up for success? Do you have proper things in place, such as reward systems, proper training, either underwear or pull-ups or whatever you choose to use, which we're going to talk about that in just a minute? Do you have the supplies that you would need to be successful? So those are some things as a parent and a caregiver to kind of think about. If your child, I mean, right now we're in a unique situation where the majority of kids are home all day. I know some childcare centers have opened back up, so that may mean your child is in childcare, school, things like that. We want to make sure that we're all kind of on board with where we're at in potty training, so that what's being done at home isn't being undone in another setting or vice versa. So now looking at the child, what are the things that we're looking at to determine, is the child actually ready? Are they showing the signs? I hear so often, so many times, I know they're ready. I know they're ready. And then as we start talking, we kind of talk through some of those things, and then the parents will be like, oh, well, maybe they're not quite ready yet. I'm a firm believer in waiting until they're ready, only because I don't like to fight with kids. And so if they're not ready yet, it's going to be a big fight, and actually they're going to win. If they're not ready, you can't win. And we're going to talk about that a little bit later as well. So we want to look at their bladder control as well as their bowel control. So looking at their bladder control, when we're talking about wet diapers, we want to see them be able to stay dry for several hours in a row on a fairly consistent basis. If you're noticing the diaper is always a little bit wet, or maybe they're wetting a little bit after every time they eat or drink or things like that, they may not quite be ready yet. We need to be able to hold it for a while before we can toilet train. Kids don't have to have all of these readiness factors, but they are definitely things to consider. Second, waking up dry after a nap and eventually at nighttime. After a nap is usually only a couple of hours, so that can kind of show us that they do kind of have that capacity to hold it for a while and not just go frequently. It's not necessary that they wake up dry in order to begin toilet training, but again, that's a sign to kind of start looking for. Kids can certainly be toilet trained during the day and not at night. And so just because they don't wake up dry in the morning doesn't mean you can't start. Another thing you might want to look for is that they acknowledge a wet diaper and or a need to urinate. If they are uncomfortable, and sometimes diapers are pretty absorbent, so being able to notice that the diaper is wet can sometimes be tricky. I know a lot of disposable diapers have a picture or a line or something on them that happens when the diaper is wet. So as you start thinking that the child might be ready, you can start to point out like, oh, look, Mickey Mouse is gone, your diaper's wet, or whatever the case may be. Sometimes it's a line, sometimes it's a picture, but kind of starting to talk about acknowledging the fact that you're wet. And then moving on to the bowel control, we want to see some sort of schedule with bowel movements. If you can kind of predict, okay, my child typically goes after breakfast in the morning. That's what I mean by, that kind of that schedule. If you're thinking like, I have no idea when throughout the day I'm going to need to change a messy diaper, then we might not quite be ready yet. This next one is not, again, it's not necessary that this be the case, but some kids will stop their play, go to a hiding space, or go to a specific place to have a bowel movement. That indicates to us that they're starting to recognize that they need to go. Again, they may acknowledge a need for a diaper change or a need for a bowel movement. They may express that they're uncomfortable. This could be just through kind of their body language, that, they may start to kind of show that they're uncomfortable by kind of wiggling around, or, things like that, where you can kind of see that their diaper is, not ready, or that their diaper's ready to be changed. I did just see a question come through that is a little bit later on, so I'm gonna hold on that one for just a minute. So moving on with readiness. So obviously those are some physical things that we need to be looking for. Those signs that the child might be kind of understanding the process of, using the bathroom. Now there's some other signs that we kind of want to look at. First, emotional readiness, meaning, are they complaining? And I don't mean like emotional in terms of like crying, not crying, stuff like that. Just kind of mean like social, emotional, and some self-help skills as well, which we'll talk about in a second. But are they complaining when their diaper is soiled? Are they anticipating the need to go before it happens? Oftentimes that will start out as recognizing, almost they'll kind of act like the need to know, but it's already happened. They might start saying potty or, things like that, and they've actually already gone in their diaper. So that could even be a preliminary step to anticipating the need to go. Noticing the difference between clean and not clean, not just with regards to the diaper, but with things in general, kind of noticing if their hands are clean or not clean, or if that bowl they use to eat their spaghetti, that's dirty versus the clean bowl that you just pulled out of the dishwasher. So kind of starting to understand those opposites. And then they like to be independent and do things for themselves. So kind of starting to get that idea of, I do it myself. We've seen kids do that, where they kind of go from where they like to be helped to, no, I can do this. I want to be in charge of myself. And then following up with some of the self-care or self-help adaptive types of things. Are they able to help a little bit with dressing and undressing? For a child to be fully toilet trained all on their own, which can be a process, of course, they need to be able to pull their pants down and pull their pants back up. So those are things that you can even start working on before you even start actually potty training, is you can kind of work with them on pulling their pants down, pulling their underwear down, things like that, and then being able to pull them back up. Helping with hand washing is another one. Again, for them to be fully trained, independent, we'd like to see them washing their hands on their own, being able to properly clean their hands, dry their hands, which again could be down the road where you feel comfortable letting them in the bathroom on their own, but these are some things we can work towards. The last is that they're drinking from a cup versus a bottle for most of their liquids. When kids guzzle down an 8-ounce bottle or more, then it's kind of hard to stay dry after you kind of drink all of that much water. There's not necessarily a correlation between the bottle and the independence of toilet training. It just can be a little harder, and it just kind of indicates there might be overall readiness when the child has transitioned to a cup. The next thing that is really, really big is talking about communication when it comes to potty training. And I think this is especially applicable when we talk about potty training with regards to special needs, is that oftentimes there is a communication delay or communication barrier, and we want to address that so that we can have success. And really we want to address it before we start with the toilet training so that we don't end up in a battle over it. So the first part of communication is our understanding or our receptive language, what we're receiving. And these are some things that I think are important as we start talking about readiness. So does your child follow simple directions? So thinking about the directions that we need to follow for toilet training, we need to understand to sit, wait, pants down, pants up, flush, wash, stand up, some basic communication directions And those are things that you can work on well before you think you're ready to actually start. The next one is just being able to imitate simple actions. So are they able to copy things that they see you do, that they see their siblings do, that they see their peers do? Imitation is a good way to kind of help with certain aspects of toilet training. So it's kind of an important precursor. We talked a little bit about the differences between clean and dirty a minute ago, but also wet and dry. So again, these aren't specific to potty training, but just in general, do they understand the difference between something that's wet and something that's dry, or something that's clean or something that's dirty? If we're using these words when we talk to kids about potty training, but they don't know what those words mean, it's not going to assist us in our training process. So if we're saying to a child, are you dry? But they have no idea what dry is, then we're not going to get the correct answer. And the concept of staying dry isn't really going to make sense. So I think these are some really good things to evaluate. We also want to see that they can sit for about 5 minutes. As we know, sometimes some of our bathroom needs take us a few minutes. And so we need to be able to sit on the toilet for a good 5 minutes without, being able to attend to sitting on the toilet. That doesn't mean that they can't have something to keep them there. Quite often as kids are training, they need a book or something, to hold their attention. But working on attention span in general can really help be prepared for toilet training. Another one is just that they respond to praise for their accomplishments, that you kind of notice they're motivated by praise. Again, they don't have to have all of these things, but these are all things that can kind of be precursors or things to look towards before we start even thinking about starting potty training. Then, as well as the understanding, we also need to be able to express. We need to either have gestures, signs, pictures, or words, some way to communicate the need to go. So kids do not have to be verbal. They don't have to be talking in order to potty train, but they do need a communication system. In the beginning, you are most likely going to be the one asking them if they need to go or telling them that they need to go. But as time progresses, we really need them to be able to tell us in order for them to be fully independently trained. So again, that's these two readiness things kind of go hand in hand, but does he have a specific strategy to communicate the need to go? And if you're kind of in this stage of thinking about starting to potty train, that's a really good question to ask yourself. And if the answer is no, that's something you can start working on right away, is a strategy to communicate the need to go. Whatever communication you're using already, that's going to be the best route to go. If you're already using some sign language, go with that. If you're already using pictures, go with that. If your child is verbal and learning words, let's work on trying to teach them words. We also have to evaluate the concept of motor skills. Gross motor skills need to be in place for a lot of kids. Being able to walk independently and then stoop, so squat down and play and stand back up, for 6 months to a year before we really start thinking about toilet training. There obviously are cases of kids who have some motor delays or disabilities that are still able to be toilet trained. But in general, if your child is doing well in their motor skills, they're just behind, that may indicate that we may need to kind of take our time when it comes to toilet training as well. We want them to be able to get themselves on the toilet and get themselves off, again, to be fully independent. So I'm thinking about our goal ultimately is to be able to have the child take care of their toileting needs on their own. And these are the things that we're looking for. Another thing to kind of just look at, it doesn't specifically have to do with using the toilet, but picking up small objects, kind of using that pincer and being able to secure something small, it more just indicates overall readiness with motor development, not that we need that skill specifically to use the toilet. So that is all of the readiness things. I find it really, really important to be really honest with yourselves about where you are at as the caregiver parent and where your child is at in terms of readiness. Before we move on to these next slides, does anybody have any questions specifically about readiness? I haven't seen anything pop up in the chat window. I think that sometimes evaluating readiness can be a little discouraging because we want them to be ready. Let's see, I see a question coming in, and unfortunately on my phone, I can't see the whole question unless I go to the chat window. So let me just go here and make sure I address this whole question. If my child is not ready, is it a good idea to just have him practice sitting on it so he gets used to the way it feels? Yes, if they're open to it. I think that if you try to sit them on the potty and they cry a lot and it's something that's scary to them, that might be another indication that we're not quite ready yet. But if you're noticing, okay, I don't necessarily see these readiness signs in place, but I want to work towards it, then having them sit on the toilet, perhaps after a diaper change or before a clothing change in the morning or evening, or before or after bath time, and just kind of start that positive experience with the toilet, I think is a great idea. And then I say just kind of monitor and see how they are. The next question is taking off the diaper. Is that part of readiness? And that is a very good question. And the answer is a complicated maybe. Sometimes it can be an indication. Oftentimes I find it to be more of a sensory issue, or more of they've discovered that they can remove their diaper. And especially when it comes to the topic of, children with developmental delay and disabilities, I don't always think it's an indication that they're ready. So I would take a peek at the other readiness factors as well. And if you're finding, yeah, they have quite a few of them, then taking off the diaper may go along with that. If you're thinking, no, they don't have any of the other readiness markers, then we might look at some other reasons why. What if they never get there? Do you just never train? There are people who don't. I would say it's typically kids that turn into adults who have very significant delays, cognitive impairments, motor impairments, things like that. If you're thinking, okay, I'm not seeing really a lot of these signs, but I think my child does have the potential to learn, then I think in that case, it might be worth just trying it out. And in that case, kind of evaluating your own readiness as the parent, as the caregiver, kind of, do I have the time? Do I have the patience? Let's give it a try for a couple of weeks. If it's not going well, let's hold off and maybe try again. Let's see. So yeah, having a lot of signs of readiness, kind of knowing what to do and we'll do it, but not necessarily being able to feel it coming. I think that is very common when it comes to training kids who maybe have some delays or some, extra needs. And I think what that means, unfortunately, is that you do just have to be on top of it for a longer amount of time, and kind of almost going on a schedule, so that it's almost like we've trained her to be on a schedule. And then she, as she gets older, can kind of start to learn her schedule. Like, oh, I haven't gone to the bathroom for a couple of hours. I should probably just go. If ultimately, you really feel like she can't, feel that need to eliminate, that might be something you might want to chat with your doctor about. That's all the questions I see popped up. I'm going to close this chat window here for just a minute. Oh, okay. So having diabetes additionally, yeah, that definitely adds to, kind of complicates the situation. I don't, right off the top of my head, have anything specific to offer you, but I am happy to ask around and look into it. If you want to shoot me an email even, I'd be happy to kind of see what, if there's some sort of solution that we can do to continue to help, because yeah, that definitely makes it tricky. You can't like stay on top of it forever, kind of a thing. So we'll move on from the readiness for now. And then, like I said, feel free to add more questions in the chat, and then as well, feel free to email me. Now that we're all ready, let's actually get ready. Now that we've decided, okay, we're ready. I see some of these readiness signs. I see enough of the readiness signs that I'm going to do it. And like I said in my answer to the previous question, that sometimes maybe you're not necessarily seeing the readiness signs, but you are ready to give it a go. So that can work as well. One thing that you might try doing in the beginning, before maybe pre-beginning, is use a chart to kind of track some patterns about 1 to 2 weeks before starting. So there are a lot of, I did a quick search on Pinterest just to see what was available. I will admit that I'm really bad with technology, and so creating a PowerPoint in the first place, I had to have help from my coworker who had this template already. She sent me her template, and I just deleted her information and filled in. Her presentation was on a different topic, and I just kind of filled in and even used some of her graphics and things. And so grabbing something from Pinterest and putting it into my presentation. I'm not working off of a computer, and so I just decided to not even go there, because I know that we all probably, I shouldn't say we all, but lots of us know how to look at Pinterest and find ideas. When it comes to making things like charts and things like that, I think a lot of times we do look at Pinterest and we're like, oh my gosh, this is like too complicated. It's too pretty. I can't deal with it. Take a sheet of paper, a scratch paper even, draw a little graph and put the different things that happen throughout your day. Wake up, breakfast, clothing change, playtime, lunchtime, and then start to kind of chart what's happening with their bladder and bowel movements. Are they waking up dry? Are they waking up wet? When are you changing wet diapers? When are you changing dirty diapers? So you can kind of get a feel for what their patterns are. I'm sure you already have an idea of their pattern, but sometimes having it just written down that you can visually take a glance and like, okay, I'm seeing after lunch, we probably need to make time for sitting on the toilet, that kind of thing. And I would recommend doing that for a couple of weeks before you really dive into the actual training. The next thing I would suggest is to gather your supplies so that you're prepared and you're not scrambling as you start to actually work on training. It is stressful for a lot of people to toilet train. So if we are already prepared, I think that we'll feel more successful than if we are doing that scrambling around looking for things. I would suggest looking for rewards, some small and some bigger. Some people like to use treats, some people don't. It's totally personal preference if that's what you want to do. But in general, I think a lot of kids do need some rewards to start the training process. And looking for small things. So when I say treats, I mean things like one chocolate chip, one M&M, could be even mini of either one of those things, mini marshmallows, something that they can have one Skittle, something like that, that is a small, if you're going to use food, something that's small. So when they sit on the toilet, they get their Skittle. If they're successful, then it's, even bigger. Stickers can be a really fun reward. So it could be a sticker chart, or just playing with stickers, or getting a sticker. Those star stickers that lots of us used when we were younger, even, those can be pretty fun. I actually sent this presentation to a friend of mine who has a 5-year-old son with Down syndrome. She has a typically developing son who I believe is 7, and then her son with Down syndrome, and then she has a baby girl. And she has toilet trained both of her kids. She's also worked with kids with special needs before she even had her own kids. And I just wanted to get her feedback to just kind of see if I was, on the right track with all of this. And she said that it's been she's noticed in her own kids and kids that she's worked with, that sometimes putting a little drop or two of food coloring in the toilet as the reinforcer as the reward, can also be so much fun. So particularly with little boys, if they're, successful, or they've sat on the toilet, put a drop of food coloring in, and they like to watch the colored water flush down the toilet. And I thought that was a really great idea, because that kind of is an alternative option if you're not wanting to use food. Or even if you are using food, it can be just another option of fun things. I think it's always good to have a good arsenal of rewards so that kids aren't getting burned out on the same reward every time. Then you also might want to think of some bigger rewards, things that they can earn. So if they stay dry for a full day, maybe they get a bigger reward. Or if they stay dry for a week, or when they're not wearing diapers anymore. These are all very individual to families and what your preferences are. Doing things like sticker charts where they can build up to earning that bigger reward. I like, especially when it comes to working with children with special needs, I like to have a visual. So if they can see every time I sit on the potty, I get a sticker, and all of a sudden my line is full and I've worked up to something. They may not quite be ready for the concept of I'm earning a bigger reward at the end, but even just visually seeing that they are making progress can be really fun. Sometimes the reward can be one-on-one time with mom or with dad, things like that. It doesn't mean you have to go out and buy a lot of things, but you might want to just look around your house for what you have available for rewards. You also want to be prepared with underwear that you're going to be putting your kids in. We're going to talk about methods for training here in just a minute, but ultimately you're going to need some sort of underwear. Some people like to use kind of like a training thicker type of underwear. Some people just go straight for, character underwear or whatever you can buy that you prefer. But ultimately we want, if our goal is out of diapers into underwear, we need to have the underwear. Pull-ups are not my favorite, honestly. They are more convenient, but they're not necessarily more helpful because they essentially are like a diaper. So if you have a pull-up on your child and they go just a little bit, the pull-up is going to absorb and they're not necessarily going to know they're wet. I'm going to give this tip again in a minute, but what I do like pull-ups for are actually to kind of help you more than them. So I'll put underwear on first and then the pull up over the underwear. So if they do have a little accident, they do feel it because their underwear gets wet or messy, and then the mess is still contained. So you're not cleaning up underwear and pants and your carpet. You kind of saved yourself some of the cleanup, but the pull up isn't necessarily making it so they don't notice that they had an accident. You also may need a step stool to help them get up on the toilet or help them reach the sink. It's likely you may have one of those anyway. A potty seat or a child-sized toilet, if you're choosing to use those things. I think a lot of kids need something to help them feel a little more secure on the toilet. However, those things aren't always available. So it's something you want to consider if you're training your child on a child-sized toilet on the ground. There's nothing wrong with it. It's just and I think it's a little less of an issue right now and probably for the foreseeable future where we're not out and about like we typically are. But let's just fast forward, a couple of years when hopefully this coronavirus is behind us and we're out and about. We're at the park, we're at Target, we're at grandma's house, we're at the library. All of those toilets are going to be adult-sized toilets. And so we want to be able to generalize being able to use those adult-sized toilets. Obviously, using the toilet in public is a whole other issue. It's a whole other issue even for a lot of adults. So, like I said, it's a whole other issue. But just kind of, decide if you're wanting to use an adaptive toilet seat or that kind of thing. Now we're going to get into probably what you all really want to know is how do we actually potty train our kids? I think that it's important to decide before you start what kind of approach you want to use in training your kids. Are you looking for something that is kind of gradual a little bit more of a casual training, in that case, kind of like the question that we had before, do we just practice sitting on the potty if they're not ready yet? Absolutely. You can totally do that. And that, I mean, you may ultimately decide to do a less gradual approach when you officially start the training, but some people like to just introduce it a little bit at a time and not really dive in full force with the actual training. Sit on the toilet before bath, no pressure, praise them if they happen to go in the toilet. That's one approach. Another approach, which many of you may have heard about, is either the 3-day method or the flooding procedure. This method is you stay home for 3 solid days, meaning you don't go anywhere. You stay home, you offer the child a lot of liquid, like all day long, very frequent trips to the toilet to catch them before they need to go. Oftentimes, especially the first day, they don't wear anything on the bottom. They are just completely bare on the bottom. They may wear a shirt, but like I said, bare on the bottom in order to really kind of reinforce the idea that we go to the toilet, we go to the toilet. This method works sometimes. I'm not I'm not spending a ton of time on the first or second method because I generally think what we're going to talk about next is a good approach for training children with special needs and all children, honestly. But if you choose to do one of these first or second, that's totally fine. There's really nothing wrong with it. There can be some frustration, absolutely, but it really is up to you and your personality as much as it is up to your child and their personality. The third approach that I'm going to spend a little bit more time on is scheduled training. So you would dress your child in pants and underwear, so diaper off, having backups available because there probably will be accidents, and really encouraging your child to pull their pants down, pull their pants up, be as independent as possible, but you are right there alongside them, helping them with all of the steps. And then to introduce this, we would sit on the toilet every 30 minutes for about 2 minutes. I suggest a visual timer in the beginning so kids can kind of see how much longer they have to sit on the toilet. They get a reward for sitting, so those small rewards that we talked about before, and then a big, huge reward with specific praise if they are successful. Good job going potty, good job going in the toilet, whatever words you decide to use, it's fine. It's very individual to families on, do you call it potty? Do you call it toilet? Do you call it pee-pee? Whatever, those are individual. Your family can decide what's best for you to use. But we want to be specific with our words so that we're telling them, oh, wow, you're dry. Good job being dry. Good job telling me you need to go potty, rather than just saying like a straight good job, being specific about our praise. And then wash their hands. Even if they did not go in the toilet, they just sat there, we want to wash their hands because they sat on the toilet. And we want to teach them that habit of when you sit on the toilet, you wash your hands. And then we check their underwear every 5 minutes for an accident or a sign that they need to go. If we notice an accident has happened, then that's okay. They will happen. We just have them do as much of the cleanup as possible in the bathroom. So let's say we set them on the toilet for 2 minutes. It's been 30 minutes. We do our 2 minute sitting. They sit there, but nothing happens. So we give them their praise and reward for sitting there. And then we wash hands and get off the toilet. And then 5 minutes later, we check and they're wet. So we say, oh, okay, your underwear are wet. Let's go change. Let's go clean up. So very flat tone of voice. Nothing. We don't want to be, they're not in trouble. We're not punishing them. We're just stating the fact. You're wet. Time to change. Let's go to the bathroom and clean up, because that's where we do toilet things, in the bathroom. You can also, and of course we change diapers all over the place with kids, but as you're starting to talk about potty training, you may even start to consider changing their diapers in the bathroom to start to associate bathroom elimination with bathroom, that actual room in your house. As you're having them help with the cleanup, if they have had a bowel movement in their underwear, if possible, have that go in the toilet, because we do that in the toilet. And again, you can use whatever words you want to for your family, but okay, that's for the toilet. Let's put that in the toilet and clean up. Very, very neutral. Again, stating the facts, try as best as possible to keep the emotion out of your voice, which leads into my next slide of, this is kind of where I'm bringing in just a small concept from Love and Logic, that empathy overpowers anger. When it comes to potty training, it can be frustrating, absolutely. But anger and negative emotion do not help at all. In fact, it usually backfires on us. If we get mad at kids for having accidents, they're probably going to start withholding. If we yell at them for having accidents, it is not going to motivate them to potty train. Punishment, again, often backfires. So I highly, highly recommend not using any sort of negative emotion or punishment or anything when it comes to potty training, especially. We're obviously not here to talk about behaviors and discipline and things like that, but I will just say that what I have found in working with kids for all of these years is that a lot of times kids don't even understand why they're in trouble. And so we punish them and they don't know why they're getting punished. So then they go right back to doing the thing that you didn't want them to do in the first place. I'm a big proponent of reward systems and positive reinforcement, but especially when it comes to potty training. I liked this graphic that, like I said, was already in this presentation before I started, but the opposite of anger is not calmness, it's empathy. And when it comes to potty training, I think a lot of times we do kind of feel angry. We don't feel calm. We don't necessarily feel empathy. But if we try to wrap our heads around what's actually happening, then I think we can kind of feel that empathy and really try to utilize that as we are potty training our kids. Dr. John Gottman, who some of you may be familiar with, says empathy not only matters, it is the foundation of effective parenting. And like I said, we're not here to talk about behaviors and discipline and all that kind of stuff, but I think it is relevant in the conversation of toilet training, because I've seen a lot of people try to use a little bit more of a negative system in potty training and, you know, trying to do punishments when kids have accidents, and it really backfires on us big time. And nobody wants to, you know, have things backfire when it comes to potty training. So we are going to, I have some tips and tricks, and then I'm going to leave a few more minutes for questions. We have about 15 minutes left, so hopefully if you do have questions, we'll be able to answer those. There's a lot to talk about when it comes to potty training. And, you know, I'm just kind of giving you a brief overview of some of the things that I have observed over the years. And if your questions haven't been answered, like I said, feel free to reach out to me. The number one tip I have is to stay calm. Even if you're not feeling calm, try to stay calm. My second is that you're not in control. Even though you want to be, we cannot make kids toilet train. We can't make kids talk, we can't make them eat, and we can't make them toilet train. I wish we could. If I could do any of those things, I'm pretty sure I'd be making a lot more money than I am now. We can't force it. You cannot make your child eliminate in the toilet. So the more power we try to enforce, the more likely they are to withhold. And we do not want that. The last thing we want is causing a child to have infections, constipation, all kinds of other things because we got into a power struggle. We're actually going to talk about power struggle here in just a second. Once you start, give it a little time before giving up. And my next tip is the exact opposite of that. If it's not working, don't be afraid to wait a little longer until everyone is ready. If you start and you give it a few days and you can see this is not connecting, they are not figuring this out whatsoever, then you may start to think, okay, maybe we're not quite ready yet. And I say we, because it can be the child, it can be you, it can be both. And it's okay to wait. I don't want to say give up because that feels a little bit negative. I want to say wait a little longer. And it's okay to wait a little longer. It's also okay to have kids in a diaper a little longer than you want them to be. Okay, so I mentioned we're going to talk about power struggles because I find this happens a lot just in parenting in general. We get into battles with our kids, and this is a losing battle when it comes to potty training. If you find yourself in a power struggle, get out. Don't fight the power struggle when it comes to potty training. It's not worth it. Offer them choices. So if they're resisting going in the toilet, offer them a choice, even possibly to go now or go in 1 minute. Or do you want to go in your potty or do you want to go in my potty? So some things that you don't mind, ultimately you really still are in control, but we don't want them to know that. So offer them some choices of things that you don't really care about. Which treat do you want for your potty treat? Do you want to read a book or sing a song while we sit on the toilet? So let them have some control where you can. Ask them if they want to get themselves up onto the toilet or if they want you to set them there. So giving them a little bit of control will make them feel a lot more like they have the power and they won't struggle so hard against you. Sometimes we just have to take a step back and realize that we are in an overall power struggle with toilet training, and maybe we need to take a step back and wait a bit longer. We already talked about the idea of using the pull-ups over the underwear so they can feel the accident but having less of a mess. If they just wear a pull-up, it often just feels like a diaper that they can pull on and off. Daytime training may occur long before nighttime training is mastered, and that's okay. Fade out rewards as you can. Remember to reward them also for staying dry. So sometimes the reward, like I said, is for sitting, but also for staying dry. So if you check them and they're dry, remember to praise that, because that is ultimately the goal as well, is that they stay dry, and when they need to go, they go in the toilet. When it comes to training boys, people always wonder, should I have them sit? Should I have them stand? A lot of that has to do with personal preference. I know some people who just teach their boys to sit to kind of avoid more of the mess. Personal preference. If they are standing, sometimes it's nice to have a target in the toilet bowl, something like a Cheerio, so that they can aim for the Cheerio rather than making a mess all over your bathroom. Messes are inevitable when it comes to toilet training, boys and girls, but we can try and teach them how best to be a little less of a mess. Sometimes having them sit backwards, especially if they're not as stable as you would like for them to be, or maybe they're small and they might feel like they're falling in the bowl, then if you have them sit backwards and kind of hug the tank, that can kind of help them to feel a little bit more secure. That can go for boys or girls. Sometimes it's nice for boys to sit backwards actually, because it lessens the potential of a mess, but there's going to be messes. That's just kind of the nature. Accidents are probable, and handle with minimal emotion and move on, like we talked about. Really try to keep it positive so that they feel hopeful about this. They feel excited about it. As soon as kids start feeling negative about the potty, we get the power struggle. If flushing is scary, teach them that it's safe and okay to flush, or maybe they need to cover their ears if it's loud. Using a visual schedule can be really helpful. A visual schedule with the steps to training, which are mentioned here, can kind of help with the sequence of what happens. We can also use a visual schedule for things like playtime, potty, lunch, things like that. Sometimes we do need to do some data tracking just to kind of see how often we're having accidents or what the patterns are, things like that. A few final things. Make sure everyone is ready, including yourself. Prepare before you start. Give yourself adequate time. If you're feeling very rushed and stressed in your life, that might not be the best time to start toilet training. Remain calm and positive as much as possible, and celebrate successes, all of them, big and small successes. Sitting on the toilet, successfully going, staying dry, all of those things. We have a few minutes for questions. I'm a fast talker, and so I kind of flew through this presentation. I wanted to get through it all, so that's part of the reason why. And then again, this virtual nature, I think if we would have been in person, we would have had a lot more pauses for discussion and questions. But as we are virtual, I just kind of flew through everything. Please feel free to use this presentation, share it with your friends. There's no copyright here on anything. I'm happy for you to use it however you would like. I know again that this has been recorded so that people can access it later. So I'm going to pop up this chat window and we'll just hang out for a bit longer and I'll answer questions, and feel free to reach out to me individually as well. Okay, so this question came up earlier and I didn't circle back around to it, so thank you for posting it again. Tips on helping children wipe and clean up and dress themselves. What are some tips if they strongly prefer to poop in the diaper? Good, very good questions. So wiping and cleaning up, I think, can be a big challenge, and sometimes that part of it doesn't really get mastered for quite a while. I think even with kids who have trained easily, the actual cleaning up process will, can kind of be difficult. So sticking with it and just continuing to practice and helping them to understand what clean actually is, when it comes to wiping yourself after, a bowel movement and things like that, making sure that you've thoroughly cleaned. As far as dressing themselves, I think starting out working on that before you're even toilet training, or if you are already toilet training, working on it separately from toilet training. Just, being able to practice every day, dressing and undressing, pulling pants down, pulling pants up. Clothing that has elastic can be easier because obviously it's easier to pull it up and pull it down. If you can kind of get their fingers, their thumbs kind of hooked around the elastic band, then you can kind of help them have a little bit of grip on the, pants or shorts. This is actually a great time of year to work on dressing and undressing because shorts are a lot easier than pants. So if you can kind of get their little thumbs hooked in the waistband and then kind of, pull it up. If we are working with pants, kind of helping them inch things up a little bit as they go. But, it definitely is a skill that you kind of have to keep working on. As far as kids who prefer to poop in their diaper versus the toilet, to a certain extent, I say just let them, honestly. If it's, again, becoming a power struggle, if they feel like it's important to you that they don't do that, they're probably going to stand their ground even harder. So, and I know that it's easier said than done to be really calm and, not having a lot of emotion, but a lot of times you just kind of have to take a step back, take a deep breath. I know it's also easier for me to not have the emotion because I'm not the parent. And I say this to parents all of the time with lots of things, not just toilet training. When I come to work with, I'm not going into homes right now, but when I go into the home, I really love your kid. I don't want them to be upset. I want them to be happy. But if they start to tantrum or power struggle with me, it doesn't do the same thing to me as it does to you because I don't have the same emotional attachment to them that you do because you're their parent. And so try to look at it as like, how would a stranger be able to react in this situation? Just being calm. So kind of circling that back to really wanting to have their bowel movement in their diaper, I just try to keep it like a non-issue. Like, okay, then go get your diaper and you can do your business in your diaper. When you're ready, you can go on the toilet, and kind of just making it very like, it's no big deal. That doesn't always work, but that's usually where I start. I see that my information has been posted again, so hopefully you're all able to get that. I am more than happy for you guys to have a copy of the presentation. If you email me, I'm happy to email it to you, or I'm not sure if Camille can get that out to you, but yes, you're welcome to use that any way you want. And Michelle, it's good to hear from you. I cannot believe that Sadie is 8 years old. It's crazy I know some of you on here, I've worked with you and your children in the past, and it blows me away every time hearing how old they are because I don't feel like I've gotten any older. So it's strange to me that your kids have gotten older. Obviously that's not true. We've all aged, but it's fun to hear and kind of connect with some of you that I haven't for a while. We have a few more minutes. Does anyone have any other questions that you wanted addressed?
Will we go? Then it's gonna take you
Okay, so your daughter will sit on the toilet but won't go. I think that's a common question, really great question. That's when I think the frequent sitting on the toilet can really be helpful. And I'm not against the 3-day method whatsoever. I'm also not like saying you should do it. I think it's something you have to kind of look into and decide for yourself. But sometimes if we can get kids to be really well hydrated and then get them on the toilet frequently so that the chance of them going in the toilet versus them going in their diaper is a little higher, then we can have success. I have known people in the past who will maybe do some things to kind of make you feel like you need to go, like turning the water on so that the sound of water makes you feel like you need to go. I've also heard of people who maybe put some water, not hot by any means, lukewarm at the warmest, to kind of, when the child is sitting on the potty. This is like so hard for me, like to not be in person and be able to show you, but you've got the child sitting. If you just kind of put a little water so that maybe it touches her skin. I've heard of some people that works. I'm not necessarily saying to do it. I'm saying it might be something you could consider just to kind of help her. If she feels a little bit of warm water on her body, that might naturally help her release. As well, just kind of helping her. I don't know if she's feeling tense or anything like that on the toilet, but kind of that idea of like stage fright when it comes to the potty, I think is real. So just kind of helping her feel kind of relaxed and comfortable, whether that means like singing a silly song or looking at a book. And I would suggest sitting there for like a good 5+ minutes and keeping it really kind of casual, kind of keeping the pressure low to have success, but not necessarily avoiding it altogether. Your daughter goes a little every time, but she doesn't empty her bladder, so then she ends up having an accident. I would say to that when she sits and is successful, to then kind of keep her there for a while longer. Like, oh, good, you went potty. Let's stay here a little bit longer and see if she can continue to go some more. That also might be something you might want to talk to your doctor about, just to see if there's any reason why or anything that you could do from that standpoint. I'm going to answer this last question and I'm going to wrap up because it is 10:30. So I don't want to keep us here longer. So like I said, feel free to reach out if you have other questions. We've been working on potty training for a few years. He doesn't initiate. Any ideas to get him to initiate? And I think this is probably a question that a lot of you have, that in training children with Down syndrome or other special needs, that they know what to do, they just are not necessarily initiating. And does he, if you ask him, do you need to go potty, is he able to answer yes or no correctly with that? And that could kind of help us determine. If he's not able to answer correctly, then we might even kind of work on that concept of, you're still initiating obviously because you're asking the question, but if he's able to properly answer that question, then you might even try to give some reminders that are a little kind of fading out your prompting. So I'm not sure, and this is again where the virtual is tricky, because if we were face to face, you could just answer me these questions really quickly. But excuse me, if you're asking him or telling him it's time to go potty, or you need to go potty, or you need to go to the toilet, go to the bathroom, whatever, and he is responding appropriately to that. Either he's saying, yes, I need to go, or he goes into the bathroom, or whatever the case may be. We may try, rather than being quite so straightforward with it, maybe we start to, you know, like if right now you're just telling him to go, then maybe you could ask him if he needs to go. Depends on his mood, so it's mixed. Okay. So yeah, you could continue with the do you need to go, and if he says no, then you can tell him, okay, we're gonna try in a few minutes then. If you're kind of thinking, okay, he hasn't gone for a while, I know he probably does need to go, but he's just his mood, he's not really, you know, he's not really doing it. And then the thing that I was kind of thinking is maybe trying some other cues. So rather than being as blunt, just even having like a picture of potty train, or I mean a picture of a toilet, or you know, something like that, where you're giving him a clue, like a prompt, but not like it's time for the potty. Or it could even be you saying to him, I'm gonna go potty, I'll be back in a minute, and see if that kind of clues him in to like, oh yeah, maybe I should have done that too. So if those things are things you've already tried and you don't feel like that's really going to be the right route, then feel free to email me and we can brainstorm a little bit more together. And it looks like that final question has been answered. So I am going to wrap us up because we are out of time. Thank you so much for joining me today. It's been my pleasure to chat with you all virtually and to hear from some of you that I have known and worked with in the past. And please don't hesitate to reach out. I'm very available by email, especially right now while I'm working from home. I have more time for those kinds of things. So good luck in all of your potty training. I hope that you all have success and that you can find some of the positivity about toilet training your kids and a little less of the frustration that we often experience. And I hope everyone has a great day.
Thank you so much, Aubrey. We really appreciate it. I will be sending out the slides to everyone who RSVP'd, and I'll put it in the chat really quick too. So thank you guys so much for coming.